This video is going to discuss CombiGuide LITE. CombiGuide is in the GuidedSMILE family of products, and it includes the pin guide, top left, carrier guide, bottom left, and osteotomy guide, bottom right. Just these three things. And this gets you through bone reduction and osteotomy guidance. And many of these cases, if they're set up for grammetry, photogrammetry, type procedures on the day of surgery, then the case is also articulated. We perform a setup, we do a case analysis. So the case is really set up for the day of surgery with those files, right? We have the files already at the laboratory. You just have to do some typical scanning, and then we reintroduce those files back into our original plan and complete your day of surgery prosthesis. So it's really a great layup for grammetry, photogrammetry type situations. It is our plastic version of GuidedSMILE, right? Almost every case we make is a metal fixation base, foundation guide, fixation base, and a metal osteotomy guide. But the plastic version is quicker, it's less costly, and we have some doctors printing this in office. All right, so save some cost, save some time, that type of thing. You just have to purchase our sleeves for the fixation base for drilling, and you have to have our fixation kit. Otherwise, good to go. Let's go through a surgery. Surgeries are conducted kind of typical for GuidedSMILE, very typical. The pin guide is tried in to make sure it fits on the teeth perfectly, no rock, no roll. And then it is removed, and then the pin guide and the fixation base are assembled outside the mouth, and a labial reflection is completed, right? You want to remove all the tissue and move it apical to the fixation base. And then you bring the pin guide and fixation base assembled together back to the mouth, and you reseat so that the pin guide is seating just like it was before you reflected. All right, be careful that the tissue is not holding it up, and be careful that the tissue is now apical to the fixation base, that it's not tucked underneath, because we have a floating guide. Right, there's a gap between the fixation base and the bone, so tissue could creep back underneath here. So just be careful, use a Minnesota or some other instrument to push the tissue up. And then you go through the typical procedure of drill pin, drill pin, drill pin, drill pin, right? There's always 4 pins. You drill and put a pin in, drill and put a pin, etc., around the arch, and then tap to seat. Now it's plastic. All right, this is not indestructible like our chrome guide. So you want to do this a little bit delicately. Be careful. Don't over tap. And just, you and the team have a little chat about plastic prior to your first surgery. That it's not like metal. It's not like all the others. And then tap it in. Now they are held together, the stacking components, with these purple, what we call stacking pins, right? These anodized purple pins. So there are 3. They're short. They just simply plunge down through the fixation base and into the lock that is holding the 2 pieces together. Right, here they are, not anodized. Unfortunately, this is a little bit of an older image, but they'll be purple so that they'll stand out. Once the fixation base is pinned, then remove the pin guide and remove the teeth, level the bone. As always, the coronal part of the fixation base is the bone reduction level. So reduce the bone down to that level. Try in the carrier guide. This will tell you if you reduced enough bone. And you could actually do the same thing with the osteotomy guide. They really serve the same function here. And if you are going to use this product for photogrammetry or grammetry, it's a question on our RX. And you need to tell us that you are, because if so, then you're going to receive a carrier guide that is monochromatic, not clear. because your scanner, your intraoral scanner, will not be able to scan this. Don't try. It sees right through it. Right. So in that case, you would just scan the fixation base and the healing collars carefully. And the fixation base can be scanned. You could spray it. So that just be careful. You could even practice a little bit. You know, the metal fixation base is very easy to scan. But as you can see here, the doctor is not using the fixation base as the fiducial for grammetry, photogrammetry. He's using a screw in the palate. All right, so you can follow that procedure. On the website, there are videos and how-tos on that whole process. But this video is more about using the CombiGuide. You can see the screw here. But once you're sure that the bone is reduced down, which means you've tried in the osteotomy guide or the carrier guide, there's no wobble, there's no wiggle, the tissue or the bone is not holding it up, then you move on to osteotomy guidance. This is a BioHorizon case, so you can see their original sleeves in here. This can be sleeved or sleeveless depending on what system. If you're using a sleeveless kit, like many on the market now, we don't have to include sleeves. We have a way of setting these plastic resin sleeves here to accommodate for your drill. And that could be maybe a little more accurate. I don't know. Could be debatable which went one way or another because you do have to cement these in. But it can be made a little quicker, easier to make in office if there are no sleeves, and certainly more affordable in office if you don't have any sleeves. Now, you have options with the drill sequencing, all right? And you also have options with the whole report. You can order a SurgiMat. We charge for it a la carte when it's the CombiGuide. It's included in GuidedSMILE, but CombiGuide is a la carte. And if you've worked with us for a while, you'll know the advantages of having the SurgiMat, the pins, the implants, the visuals, the bone reduction imaging, the cross sections. It's just very helpful during a surgery like this. All right, or you can have the typical report that comes out of the new software that we work with. It's a very nice report. Shows all the images, gives you a list of all the implants, the parts, the abutments, especially if the implant the implant company has shared all of their information with us. Then the actual componentry and part numbers are on here for ordering and for verifying in surgery. And then some of the companies, as in BioHorizon, has provided us with the entire drill sequence, right, which is really nice to have, right, especially if it's newer kit to you. But nice to have a drill sequence in the report. That is not typical with other softwares, right? A lot of other softwares force you to use generic things. All right, so implants are in, been through the whole process, and then pick your poison for the restorative part. Anything you want to do at this point is possible, but we have guided the implants and the bone reduction, and we've done it hopefully according to a new LITE vertical dimension that we have opened on the articulator because you ordered it as a grammetry photogrammetry case. Otherwise, we work with what we have, with the teeth that are remaining in the mouth. We don't do a full setup. We don't do that whole workup typically for CombiGuide. Only if you've upgraded it to a CombiGuide for photogrammetry, grammetry. And that is CombiGuide LITE.